For millions of Americans living with diabetes, the daily reality of managing their health has long been intertwined with a significant financial burden. The cost of insulin has historically been a source of immense stress, forcing families to make difficult choices between their health and other essential needs. However, as we move through 2025, a positive transformation is taking place. This year marks a pivotal moment where access to affordable insulin is becoming more tangible. The landscape is changing for the better, bringing renewed hope and security. The importance of this shift cannot be overstated. When insulin is affordable, people are more likely to stick to treatment plans. That consistent management helps prevent serious long-term complications, heart disease, kidney failure, nerve damage. Making insulin accessible is about public health and empowering people to live healthier, more productive lives. The conversation is shifting from crisis to well-being. This new affordability is the result of efforts by policymakers, healthcare advocates, and others. Patients and families were heard, leading to landmark policies and targeted programs to dismantle financial barriers. When communities demand change, progress follows. The 2025 changes are a direct result of that advocacy, moving us toward a more equitable healthcare system. I'll guide you through these developments. I'll give clear, practical information you can use now. We will explore new policies, highlight low-cost options, and offer practical tips to navigate this landscape with confidence. This is empowerment. Knowing your options is the first step to control your health and finances. A major catalyst for the lower insulin prices we are seeing in 2025 is a series of new and updated government policies. Lawmakers have taken decisive action to cap out-of-pocket costs, recognizing it as a critical public health issue. One of the most impactful changes has been the expansion of a federal law capping the monthly copay at $35 for a vast majority. This includes those covered by Medicare and now, increasingly, those with private commercial insurance plans. This simple, direct cap provides predictability and immediate financial relief, ending the days of shockingly high pharmacy bills for many. To understand how this helps, let's look at an example. Previously, a person with a high-deductible health plan might have been forced to pay hundreds of dollars for a one-month supply of insulin before their insurance began to cover a larger portion of the cost. Under the new regulations, that same person's monthly expense for their insulin supply is capped at just $35. Furthermore, these policy changes have encouraged greater competition within the pharmaceutical market. The government has streamlined the approval process for biosimilar and generic versions of insulin. These function like their brand name counterparts, but are sold at a significantly lower price. This move is designed to break up market monopolies that have kept prices artificially high for years. By fostering a more competitive environment, these policies are driving down the baseline cost of insulin for everyone, creating a ripple effect of savings across the entire healthcare system. The result of these government actions is a healthcare landscape where financial toxicity from insulin costs is actively being reduced. The pressure on family budgets is easing, and the fear of rationing or skipping doses is diminishing for a growing number of people. These policies are not just numbers on a legislative document. They represent a lifeline and a signal that your health is a priority. Now, let's explore the low-cost options you can actually use. Beyond the helpful new government policies, the pharmaceutical industry itself is responding with more affordable options in 2025. Several manufacturers have lowered list prices or introduced lower-cost, unbranded biologics. These biologics are chemically identical to the well-known brands but come with a much smaller price tag. Major companies, Eli Lilly, Novo Nordisk, Sanofi, now offer programs that make insulin significantly cheaper. These programs often align with the $35 copay cap. Another powerful avenue for savings is the growing availability of generic and biosimilar insulins. Think of a biosimilar as a generic version of a complex biological drug like insulin. These medications have been rigorously tested and approved by the FDA, confirming they are just as safe and effective as the original brand name products. Examples include Semglee, a biosimilar to Lantus, and Lispro, a generic version of Humalog. Asking your doctor or pharmacist about these alternatives can lead to substantial savings without compromising treatment quality. They can prescribe a biosimilar or generic, offer samples, or suggest alternatives that fit your needs. Patient assistance programs, often run by manufacturers, remain vital for the uninsured or underinsured. These programs provide free or very low-cost insulin to people who meet income criteria. The application process has become more streamlined, with many online portals to make it easier to apply. Visit insulin manufacturer websites or check nonprofit sites like NeedyMeds to see if you qualify for support. Finally, some innovative companies are entering the market with a mission to provide insulin at a transparent, low cost. The Mark Cuban Cost Plus Drug Company, for example, offers insulin at a fraction of traditional retail by cutting out middlemen. They provide clear upfront pricing so you know exactly what you will pay. Exploring these new purchasing models can be a game changer, offering another dependable pathway to secure insulin without financial strain. They are another dependable pathway to secure the insulin you need. Next, practical steps you can take right now. Price caps, increased competition from generics, robust patient assistance programs. Together, they form a safety net. They are creating a powerful safety net, ensuring your health is no longer dictated by your income. This is real momentum, and it's working now for many people. If you're struggling, reach out. Help is available through helplines, pharmacists, and nonprofit resources. You have more tools at your disposal than ever before to manage the cost of your insulin. Talk with your doctor about new options. Telehealth makes that easier than ever. Explore manufacturer programs, biosimilars, discount providers, and affordable direct-to-consumer models. These options can reduce monthly costs and improve medication adherence. Now, practical steps you can take today. Price caps, biosimilars, manufacturer assistance, and cost-plus providers. Options are available. Let's walk through how to use these options to save money starting today. Practical step-by-step, coming up next. Knowing that affordable options exist is the first step, but taking action is what will put money back in your pocket. Your first and most important conversation should be with your doctor. Be open and honest about your financial concerns. Your physician can be your greatest advocate, helping you identify cost-effective insulin options. They can write a prescription for a lower-cost biosimilar, a generic version, or provide samples when available. Don't be afraid to initiate this conversation. Doctors want to help you succeed with your treatment. They can suggest clinically appropriate, lower-cost alternatives. Next, become a savvy shopper by comparing prices at different pharmacies. The same prescription can vary widely. Call local pharmacies, check large retail chains, and look into mail-order pharmacy programs. Mail order can reduce costs and provide predictable refills. Always ask the pharmacist if there are coupons or discount programs available. Use prescription discount apps like GoodRx, SingleCare, or Blink Health to find lower counter prices. Download the app, type your insulin name, and present the digital coupon at the pharmacy. Review your health insurance plan carefully, especially during open enrollment. Look for plans with better prescription coverage or a formulary that lists preferred, low-cost insulins. Call your insurer and ask for a list of covered insulins and associated copays. If you qualify for manufacturer assistance or nonprofits, apply. Many forms are now faster and online. Keep refills organized and use reminders so you never miss doses. Consistency keeps you healthier and reduces emergency costs. Use discount cards in your wallet or phone for quick savings at the counter. Checklist. 1. Talk to your doctor. 2. Compare pharmacy prices. 3. Use coupons, apps. 4. Check assistance programs. 5. Review insurance. A few phone calls or clicks can save you a substantial amount of money each month. It's simple, quick, and effective. You do not have to navigate this journey alone. A network of support is ready to help you succeed. Remember, managing diabetes is a marathon, not a sprint. And affordable access is crucial for staying on course. Refill on time and keep a routine. The landscape of insulin affordability in 2025 is a testament to advocacy, innovation, and compassionate policymaking. The days of impossible choices and overwhelming stress are starting to recede. Price caps, generics, and assistance programs are building a stronger safety net. Take these practical steps, explore the resources mentioned, and reclaim your peace of mind. Save more, stress less. Focus on living a full, healthy, and vibrant life. The progress is real. The hope is justified. This is a victory for patients. Access to life-saving treatment is a right, not a privilege. You have every reason to be optimistic about what lies ahead in your diabetes care journey. Visit the links in the description for direct resources and step-by-step guides. Thanks for watching. Subscribe for more practical healthcare updates.